from before they're even born.
The nearest hospital is an hour and 15 minutes away.
To daycare.
As a parent, I did not know that there was a difference between licensed and not licensed.
To high school.
Well, I felt like the school had kind of turned their backs on me.
Some of Indiana's most vulnerable are at risk. That's why Call 6 Investigates is going to work.
What have you done and what resources have you dedicated to doing that?
Seeking results and accountability from those in power.
How is it possible that this woman can still watch children at all?
And pushing for solutions to keep Indiana's children safe, defending those who can't defend themselves. This is a Call 6 special report, Protecting Hoosier Kids. Thanks for joining us. I'm Call 6 Chief Investigator Rafael Sanchez at the Indiana State House, where every year, lawmakers introduce dozens of bills meant to keep Indiana families safe, including children. And lawmakers still have plenty to tackle. That's because right now, Indiana ranks at or near the bottom on several key factors. Take a look at some of these numbers. The Hoosier State has the 7th worst infant mortality rate in the country. Indiana has the 2nd highest rate of child abuse. And we rank 3rd out of 37 states in the percentage of students who have seriously considered attempting suicide. In this Call 6 Investigate special, we're uncovering the stories behind the data and looking at how to change those numbers for the better. Whether it's lawmakers taking action right here in the State House or Hoosier families doing it themselves across the 92 counties across our state. We start with Call 6 Investigate Stephanie Wade, exposing a risk children face before they're even born.
I'm here in Allen County, one of 20 Indiana counties where babies have the highest risk of dying before their first birthdays. That's why the state's first OB Navigator program was established here after lawmakers passed the initiative and Governor Holcomb signed it into law. The program connects women in the highest risk areas with home visitation services during and after pregnancy. Access to care is a major issue for expectant mothers across the Hoosier State. Call 6 learned 33 out of 92 counties in Indiana are considered maternity deserts. They do not have a hospital or an OBGYN physician. To put that in perspective, data from the State Department of Health and the CIA show women in Iraq and the Gaza Strip have a better chance of surviving childbirth than women in those counties right here in Indiana. And when women get the right care during their pregnancy, they and their babies are more likely to survive. But Call 6 found thousands of women are having to travel out of their home counties just to be seen by a doctor.
Today is the day. While nervous, you feel a sense of comfort knowing you made it safely to the hospital and you're surrounded by doctors as you await your baby's arrival. Some might say this is what an ideal delivery looks like. But for women who live out here in rural communities, this might not be their childbirth story. Rather, theirs is filled with anxiety and the possibility of what can go wrong.
It's hard because we have to drive clear to Lafayette.
Ashley and Rodney Newkirk, expecting twins soon, live in Crawfordsville.
It's a good 45 minutes to the hospital that we'll be delivering at. And that goes the same for like a real ultrasound. We have to go for that 45 minutes as well to get the ultrasound tech.
For Caitlin Catterson, who lives just 30 minutes south in Waveland.
It's an hour and 15 minutes away. I'm going to be in labor on our way to the hospital.
Both women have a high-risk pregnancy.
I have pre-diabetes, but I think right now they're watching me to make sure that he doesn't develop gestational diabetes.
Both live in Montgomery County, one of the worst counties in the state with access to care. The only hospital there quit delivering babies back in 2011. For them, the nearest OBGYN is based in Lafayette in Tippecanoe County. That's where they'll have to travel to deliver their babies.
The ambulances were delivering babies tenfold from what we were when we delivered here.
Call 6 Investigates found 33 out of Indiana's 92 counties either have no hospitals or the hospital has no OB services where women can receive medical care before and after pregnancy, meaning women in more than a third of our state are living in maternity deserts.
The numbers of hospitals that actually provide OB care are decreasing, and then the acuity of our patients is going up. So it's like this perfect storm of worsening, more acute patients with less resources.
When you're living on an income that is not, substantial, and you have to make a decision between spending your gas money to go to the grocery store or going to an OB appointment, that's a decision.
Experts say we find ourselves in a statewide crisis where Indiana's maternal mortality rate is the 3rd highest in the nation, and our state's infant mortality is the 7th highest. Getting adequate prenatal care is critical in preventing death.
It is difficult to get good quality providers that want to come here and stay here.
So why are hospitals closing their doors? Turns out it all comes down to money. Doctors say because of stricter state guidelines and increasing expectations for levels of care.
NICUs are very expensive to staff, if you can find enough staff for them, so you have a shortage of neonatologists, and then the facility is excruciatingly expensive.
And there's just a lot of those hospitals that do not have the resources to do that.
People are coming up with their own solutions, though. Community paramedic Darren Foreman has decided if women can't get the care they need, he's going to bring it to them.
Tell me we can buy some prettier weather.
Darren leads Project Swaddle in Crawfordsville, where every week he drives 2 patients in rural areas and sees them at their home at no cost to the families.
Any problems?
And it's not just Darren. Franciscan health nurses based in Indianapolis have created their own training program for when things go wrong and you're an hour away from the nearest hospital. Training paramedics in rural communities using a breathing, high-tech mannequin to simulate real-life emergencies they'd experience in transit.
With a pregnant mom, she could deliver in the truck for them. She could have bleeding. I mean, there's just all kinds of stuff that they've got to be prepared to manage.
Because to them, leaving a gaping hole in services for women across the state.
This is not a problem that's going to go away.
The Franciscan Health Paramedic Training Program and Project Swaddle are both funded through grants they obtained on their own, but now the state is putting $3.3 million into the OB Navigator program. The Allen County program just got off the ground in January, connecting pregnant women with home visitation services like Healthier Moms and Babies.
The state really wants to try to figure out ways that we can get those moms who aren't connected. And even as a community, we still need to work on that as well.
And Raphael, another issue putting Hoosier children at risk is the conditions some pregnant women face in the workplace.
Stephanie, let me take you to the state Senate. There, Senator Ron Alting of Lafayette, he introduced a bill that would have required employers to provide reasonable accommodations for women who are pregnant. Examples include more frequent or longer breaks, a temporary transfer to a less strenuous or less hazardous position, and assistance with physical or manual labor. If those requirements were in place during Tawani McClellan's pregnancy, she says that could have prevented a heartbreaking loss. She tells Call 6, despite having a doctor's note saying she should be on light duty due to a high-risk pregnancy, her restaurant manager, where she worked, still required her to do strenuous work.
Thinking to myself, why do I keep coming back? Why would I keep coming back? But I felt like I had no choice. I felt like that my medical was not going to cover anything, all the things that I needed. I felt like that if I left, I might go somewhere else and the same thing might happen. I really didn't know what would be the outcome for me and my child. So I continued on working, and basically it became really hectic. Eventually, I lost my child. And It hurt so bad, and I still had to go back in that place after the fact that I lost my child. And look at this guy in his face, to know that he had no compassion. He never even asked me after I came back to work, what happened? You know, are you okay? Any of that. He just, work as usual. Work as usual.
Under current Indiana law, an employer has to provide accommodations if a woman develops conditions that fall under the Disabilities Act, and if she can prove the employer has made similar accommodations for another employee. The current law will stay as is, and that's because the bill introduced to expand workplace accommodations failed. After getting through the stress of childbirth and the first few months with a new baby, many parents head back to work, either by choice or necessity. That brings us to a huge safety concern for many Hoosier families, picking the right child care provider. Call 6 Investigates' Kara Kenny joins us now.
Daycares like this one are fully licensed under Indiana law. You can tell because their license is posted on the wall right when you walk in. Now, being licensed means you have to follow certain rules, like having a certain number of workers per student, like 1 teacher for every 4 infants. Call 6 Investigates found some child care providers not following the rules, and in some cases, ignoring the rules altogether.
For Melissa Lucas, daughter Mackenzie is the light of her life.
It's constantly running through my head. Is she safe? Is she safe? Is she safe?
Safety was on Melissa's mind when she met Jennifer Martinez at her Greenwood in-home daycare. But months later, Mackenzie was injured there. It's still unclear what happened to cause the bruise on her eye. Records show the state has cited Martinez time and time again for having too many children without a license. In Indiana, a child care provider needs a license if they're watching 6 or more children unrelated to the provider. Since 2015, state inspectors have counted 10, 12, even 15 children at Martinez Daycare. And when police responded to the call about Mackenzie's injury, they found 17 children at the home.
Were you aware of the history that she had with the state when you took your child there?
Absolutely not. Had I known, I would have never sent my daughter there.
Martinez reached an agreement with the state to stop watching more than 5 children without a license. But when Call 6 Investigates stopped by Martinez Daycare in January 2019, we counted 6 children leaving one evening. In February 2019, we saw 5 children dropped off.
Jennifer, Kara Kenny with WRTV.
Martinez emailed us later saying, I am completely in compliance with the state of Indiana regarding my daycare. I do not wish to speak to you, and I don't appreciate you showing up at my home.
How is it possible that this woman can still watch children at all?
The attorneys who are handling these cases work vigorously to make sure that the people are following the law and working for the public safety. As far as saying you can't watch kids at all, that's not an option that we have in this civil court.
Martinez moved to another home, and our sources say is no longer operating a daycare. On the state's website, Martinez is listed as a provider that has operated illegally. Melissa Lucas wishes she had known.
As a parent, I did not know that there was a difference between licensed and not licensed. And it makes me feel like a terrible mom. I let my child down. I was supposed to protect her, and I didn't. And it kills me inside.
If you choose a licensed center like this one, know they have to do criminal background checks on their staff, CPR training, as well as safe sleep training. If they're not licensed, they do not have to do those things. You can check out a child care facility by going to childcarefinder.in.gov and look for complaints and inspection reports. You can also find a list of providers who have operated illegally in the past.
Still ahead, the need to protect Hoosier kids does not end when they head off to school. The risks they face in the classroom and what's being done right now to keep them safe. Security, lead testing, reckless driving around school buses. Some of the school safety concerns that lawmakers are addressing here at the State House. But there are many other issues. One big problem, bullying, and how to stop it. It's an issue Kara has been following for years.
Bullying is no longer thought of as harmless teasing. It's been linked to poor classroom performance, depression, and even suicide. Representative Greg Porter is a leader in the State House when it comes to bullying reform. Prompted by our reporting, he passed a law in 2018 that allows the Department of Education to audit schools if parents suspect they're not reporting bullying accurately. That law also requires the State Department of Education to send out yearly reminders to schools about their duty to report bullying. Porter's latest effort is a push for charter schools and private schools to adopt anti-bullying policies if they accept funding or financial assistance from the state. Public schools are required to report bullying incidents to the State Department of Education, and many charter schools are reporting as well. But private schools are not sharing their bullying numbers.
If you're receiving state dollars, you should be held to the same accountability as everyone else. You should not get a pass. And as we all know, bullying happens in schools all the time, and we just need to understand what is going on in regards to the school environment. The psychosocial well-being of our students is important in regards to a learning environment.
Call 6 Investigates found half of Indiana schools did not report a single bullying incident in the 2018-2019 school year. The Indiana Department of Education needs at least 2 parent phone calls about a school to audit its bullying report. If parents believe their school's bullying numbers aren't adding up, they're asked to call IDOE at this number, 317-232-0254. The problem is bullying numbers do not contain any student information, so parents don't know for sure if the school reported their child's incident to the state. So there's still a lot of work to be done. Another disturbing statistic involving Indiana students is sexual assault. The Hoosier State is ranked 4th worst when it comes to high school girls reporting they've been raped, and 6% of boys say they've been forced to have sex. In some cases of alleged sexual assaults in schools, the districts are accused of mishandling the reports. Federal officials launched an investigation into Hamilton Southeastern schools after 2 families filed complaints in 2019. One of those families shared their concerns with Call 6. Amaya Armstrong just started her senior year at Hamilton Southeastern High School.
I think I want to be a doctor or a lawyer. I know that I want to help people.
Amaya says it's taken nearly 2 years to recover from what she says happened at the age of 15. She was a sophomore when she says an older male student sexually assaulted her.
He said that he wouldn't let me out of the car until I performed sexual acts, and when I told him I wasn't comfortable with that, he forced me to do it.
Amaya and her parents reported the alleged assault to law enforcement and HSE school officials.
The kids were horrible to me, and I felt so alone. My friends had turned their back. I had a few true friends, but I just felt so alone.
Amaya successfully obtained a protective order against the male student, but he could legally still attend the same school.
I would see him, and it was absolutely horrible. I didn't feel safe.
Amaya ended up leaving HSE High School her sophomore year.
What do you think the school could have done better?
I think they could have provided me with resources on how to cope, and instead I had to find that out by myself. There was nothing that they helped me do. Well, I felt like the school had kind of turned their backs on me.
Title IX is a federal law that says a school has a responsibility to respond promptly and efficiently to sexual harassment allegations. In its findings just released to Amaya and her parents, the U.S. Department of Education says it had concerns HSE did not appropriately determine whether a hostile environment existed for Amaya following the alleged sexual assault. The feds also had concerns the district did not appropriately follow up on reports that additional students may have been sexually harassed by the same male student.
They didn't talk to people like they could have. They didn't protect. They just didn't know what to do.
As part of its agreement with the feds, HSE has started to implement several steps, including improving its Title IX training, improving its documentation procedure of sexual harassment complaints, and the district points out the federal investigation did not result in any violations. telling us as part of that process, we agreed to share information with the department for a limited period of time. While unrelated to the agreement with the department, we have proactively engaged in efforts to improve our non-discrimination and anti-harassment procedures and professional development opportunities for staff and students. We will continue to monitor and refine all of our practices to reflect our continuing commitment to educational community, equity, and respect.
Do you feel like this was an adequate punishment or finding?
No. I think a lot more should have been done. I think that the district should be held accountable more than that.
6 school districts in Indiana are currently under investigation by the Federal Office for Civil Rights for how they handled sexual misconduct allegations. As for Amaya Armstrong, she will soon be attending college and has already received more than $92,000 in scholarships.
That family expressed a lot of frustration, and so did others. But there's also a lot of hope. Moving forward, Call 6 Investigates will continue to push for positive changes.
World Championship.
As Indiana's 2020 legislative session wraps up, many groups are thanking lawmakers for their efforts and for bringing special attention to their causes.
Last week, hundreds of court-appointed special advocates celebrated CASA Day at the State House. These are the people who serve as a voice in court for victims of child abuse and neglect, ensuring that all Hoosier kids have a safe place to live and grow.
The kids absolutely need this because they really don't have anybody else who is the only people looking out for what is best for them. Nobody else is solely looking at the case through the eyes of the child, and that's what CASA does. What is best for these kids?
And in February, a group working to make sure Indiana mothers and babies are healthy celebrated Doula Day here at the State House. Legislators and birthing professionals met to discuss policy and improving birth outcomes in Indiana. Lawmakers have also formed a maternal health caucus to focus on reducing maternal and infant mortality. They're working on a year-long postpartum plan for every Indiana mother. And just because lawmakers are done working for the year does not mean we're done working for you. We're going to keep pushing for answers and accountability from those who have the power to make changes in our state.
And to see our Call 6 Investigates coverage on the issues impacting kids, go to our website, theindychannel.com/protecting Hoosier Kids.